Hi, everyone. Welcome back to Revenue Cycle Decoded, where we are cracking the code on revenue cycle issues. Today, I just wanted to riff a little bit on a topic that kind of chaps my hide a little bit. And that topic is billing errors that are costing your patients money or time. So let's get started with this topic. The reason that I wanted to talk about this topic today is that I just received a bill from my dentist. Of course, dentists are not fun in the first place, at least not usually, but getting a bill is even more not fun. You want to be billed accurately from your dentist, and unfortunately, this bill was not accurate. So let me tell you a little bit about it. I went to the dentist and had a cleaning and received the bill. I'm in network. My health plan is in network. The dentist is in network with my health plan, I should say. And so they submitted the claim to the health plan. The EOB came back to the dentist with a denial for one of the services that was billed, for the reason being that it cannot be billed on the same day as another service that they also billed for. So let's break that down. If there is an administrative denial on a claim because two services can't be billed together on the same date of service, that's an administrative denial. You can't then go and balance bill your patient for that according to your contracts with your payers. Unless, if it's something that is not normally covered by the payer and you have received the patient consent to cover that, that's a different story. You have to explain to the patient that this is a service that isn't normally covered by the payer. And therefore, if the patient wants it performed, then they would be responsible to pay for it. They sign a consent stating that they are going to be responsible for that service, and then you can balance bill the patient. But in this case, it was an administrative denial. The reason being that the code itself, the CPT code or the HCPCS code, specifically states that it cannot be billed with the other service on the same date of service. Is this the intent of the code? So they had seen the denial on the EOB, but they had added back the portion for the denied service onto my patient responsibility and sent me a statement for that amount. Now, because I am a certified coder and a certified biller, I immediately questioned, why am I being billed for a service that was denied? I looked up the codes so that I understood what exactly they were billing for. And I also looked up their professional association guidelines, the American Dental Association, and found that there is indeed a specific guideline for these two codes, which state that because of the code definition of one of the codes, they cannot be billed together on the same date of service. And it recommended other codes that can be billed for an exam, for example. Then I also contacted my payer to make sure this was an administrative denial and that I was correct that the dentist cannot bill. So the good news is I did call my dentist, talked to their front office person who will forward my concern on to her manager. But interestingly, when I discussed the issue with the claim, she stated, "We've never had somebody bring this up before." Now that gives me a bit of pause because that tells me that they may be routinely billing these two codes together, and patients who are not certified coders and certified billers may not understand the reason that they're getting balanced billed, and they may just be paying it. In other words, they may be paying something that they really legitimately don't owe. And the fact is that the office is incorrectly billing them and it's costing the patients money, or at the very least, time, as it did me, to look up the error and to inform the office of the error. So hopefully the next statement I get, the error has been corrected and the amount has been adjusted off. But this is why it's important, first of all, for patients to look at their claims and understand what they're being billed for. But as we all know, patients are not coders and billers. They don't know the Byzantine rules that we live by. And that is why, as a practice manager, it falls on you to make sure that your billing staff and your coding staff understands the codes that you're billing and understands what's going on the claims. They need to know any edits that apply to the codes. They need to know any policies, regulatory guidelines, medical policies, clinical guidelines, utilization guidelines, local coverage determinations and articles, all of those different payer guidelines, authorization requirements, anything that has to be met before they will approve the code. Your staff needs to understand that. This is why it's important to have professional coders and billers on your staff, or at least somebody who is very, very aware of the codes, what their definitions are, and all of these things that go into whether or not the code is payable. Otherwise, your patients who don't know all of this could be inaccurately billed, and they may be paying you what has been dropped to their patient responsibility when really it should not have been, because it was a billing error by the office. This isn't the first time it's happened to me. A few years ago, I had a screening mammogram done, and according to my health plan, screening mammograms are covered at 100%. So imagine my surprise when I received a bill from the hospital for the screening mammogram for the full amount of the screening mammogram. And when I received the EOB from my health plan, it had denied the service as not meeting medical necessity. Okay, now hopefully, if you have a patient that this happens to, they would question it. They would call up the billing office and they would say, why was this denied? Because it's a screening mammogram and it's supposed to be covered, and somebody would look into it. And that is what I did. But you may have many, many patients who do not know to do that and would just pay the amount, thinking, oh, okay, it must have been denied for some legitimate reason, and I'm just going to pay it. Or even worse, they don't pay it, they don't question it. They just look at the bill and they think, oh my God, I can't afford that. And they just don't pay it. And we all know we have lots of patients that, for whatever reason, don't pay their bills and may not communicate. And in this case, because they're not questioning their bill, you may not be looking at it either. And so they could end up getting sent to collections over a medical bill that they legitimately should not owe. In my case, once I called and we dug into the problem, the provider had put a primary diagnosis of essential hypertension on the claim, which of course didn't meet medical necessity for a screening mammogram. And they had to go back and recode and resubmit the claim. These are the kinds of billing errors that can end up costing your patients. It may cost them in time, just the time to look up and call you and sit on the phone and try to figure out what's going on with the claim because it's wrong and they know it's wrong, or it's costing them in money because they are paying for a claim that they really don't legitimately owe, or or they're getting sent to collections for something, again, that they may not legitimately owe. So just to reiterate for this episode today, how important it is to be an advocate for your patient in the billing process. Not only is it important for us to educate our patients about what their responsibility is and what they will owe for services that they receive, but it's also our responsibility to be a patient advocate in making sure that our billing is correct to the very best of our ability. Now, I know we're human, things get past us, right? But we need to understand, like I said, the code definitions, the policies, the edits, the requirements, the payer requirements, the authorization requirements, et cetera, et cetera. We need to understand that. We are the professionals here. We are the ones who are supposed to understand the billing and coding piece of our practices. So just want to remind you to remind your billers and your coders, double check those claims, run them through the scrubbers, run them through the edits, make sure that the diagnoses make sense, have somebody actually looking at the documentation before you're coding and billing out those claims. Make sure the information's correct. This is such an important piece of the revenue cycle, but it's also so important for your patients. Be your patient's advocate today. Make sure their claim is correct. Thank you for listening to my rant today. And I would like to invite you to join me in the Facebook group, Revenue Cycle Decoded, or on LinkedIn, Revenue Cycle for Healthcare Practice Managers, and ask any questions that you might have, or just join us and add your input. Also, you can find me at revenuecycledecoded.com, where I have a webinar about the different sections of the revenue cycle and what can go wrong that may keep your claims from being paid in each section. And that webinar is completely free. It lasts about an hour. It is on demand. So all you have to do is enter your name and your email address, and you will get instant access to the webinar. And I promise you, it is jam-packed with information and action tips that you can take. I also have a course available now to help you manage and prevent your front-end revenue cycle denials. And you can find that also at revenuecycledecoded.com. And that course right now is just $47 for a limited time. And it is over 2 hours of content with action items and tools to help you be successful in managing and preventing your front-end revenue cycle rejections and denials. So I invite you to come and check those out. So join me next time on Revenue Cycle for Healthcare Practice Managers podcast, or on our video YouTube channel. Follow me on Facebook at Revenue Cycle Decoded. Thank you.